This is one of the latest vaccination centres to open its doors, inside a mosque and community centre. It's popped up today, but organisers are hoping it won't be gone tomorrow.
We're here today as the first test. If this goes really well, we're talking to the local council, we're talking to the mayor, the clinical commissioning group at Tower Hamlets, the council and others here locally about being here on a longer term basis. We'd love to do that. We've seen it's a success today and would love to come back again.
This community look up to the mosque. The mosque carries a lot of weight, what they say. Doing it here really cuts through any issues around whether this is religiously okay, for example, which we come across, or that you can't have it. So doing it here, and plus I think people feel much more at home here. So although it's challenging for us, we'll do whatever it takes to get the patients to take it.
And today, a leading surgeon has added his voice to the calls, urging people from ethnic minority backgrounds to take up the jab.
We're trying to understand where the questions come from, why there's mistrust, what is related to the past, what's related to now, and how we can move forward.
But overall, vaccination rollout is going well. The number of people who've now had their first jab stands at over 11 million. Success of the vaccination programme, the R rate being slightly lower, hospital admissions levelling off. With all of this more positive COVID news, attention is turning to when things could get back to normal. When could that pub reopen? When could we sit in restaurants again? So the big question is, what could open and when? Boris Johnson pencilled in the 8th of March for the reopening of schools in England. And if infection levels are low, this is the reported timetable. Outdoor sport and limited social gatherings inside could be after that, with non-essential shops potentially coming back in April. Then pubs and restaurants could follow in May. But this all depends on science and data. The Prime Minister is said to be very cautious, but has promised clarity by the 22nd of February. With many streets looking like a ghost town frozen in time, pressure is growing from his own MPs to unlock as soon as possible. Those still working through COVID cases in hospital are more cautious.
But we're nowhere near taking the burden off of a hard-pressed healthcare service so we can return to normal business. And if we have another bout of reinfections, we will undo all the good work that's been done so far. So we're still in a very tentative stage where we are coping and delivering high quality care, but we do not need to expose ourselves to an increased burden of cases right now.
Back at the mosque, the focus is firmly on vaccinations. Everyone here saying they're trying to do their best for the community, including 11-year-old Hassan.
I think it's very important because it's just helping in this pandemic, and it's just a good thing to do on my part.
Here they're hoping to expand so even more people can take the jab. And organisers say their main mission is to prove the vaccine is nothing to worry about.
Well, joining me now from Cambridge is Dr. Deepti Gurdasani, who is a clinical epidemiologist at Queen Mary University of London. Thanks very much for talking to us today. Undeniably good news, this idea that we'll meet that target of the over 50s vaccinated in May. But what, in your view, does that actually mean for lifting lockdown?
So I think we need to really look at vaccine rollout separate from easing lockdown. Vaccines reduce severe disease in the people who are being vaccinated, but in the numbers that are being vaccinated, we're not going to see an impact on transmission anytime. Easing lockdown has more to do with the cases that we have right now and where we are in a pandemic response. And we cannot ease lockdown until cases come down much lower. We've been here 2 times before. This is our 3rd lockdown. And both times we eased lockdown early, leading to a rapid surge in cases and leading to repeated lockdown. So it's very important that we don't squander the gains of this lockdown. Infection rates are still very high. The Office for National Statistics survey suggests that we had about 800,000 cases in the week ending January 30th. So until cases come down to much lower levels, we can't consider easing lockdown at the moment. Even imperial... Sorry, go ahead.
Sorry to interrupt you, but it is difficult, isn't it? Because the success in vaccinating more and more people inevitably piles pressure on the idea that lockdown can be lifted.
Yes, and that's true. But we need to remember that if there's high levels of transmission, it'll lead to many more cases of long COVID. It will provide conditions for more virus adaptation. I mean, just looking at imperial modeling, essentially in the most optimistic scenario of vaccine effectiveness, we start easing lockdown in March, we could see up to between 80,000 to 150,000 deaths, total deaths by June. And that's a very high number because all vulnerable individuals will not be vaccinated and will not be protected. And we could easily reach ICU capacity as well, given the majority of people in ICU are below 70 years of age.
So just one of those big questions that's constantly being raised is about the return to school. You know, we know young pupils in Wales and Scotland may go back after February half term, and the government in England is talking about a sort of tentative return in March. Where do you stand on that exactly?
I think it's quite unrealistic, particularly given the government hasn't done anything to put mitigatory measures in place in schools. So we closed down schools because they were contributing a lot to transmission, but we are now considering opening them without actually dealing with that issue at all. So I think unless we do a lot more to make schools safer, it's very unlikely we'll be able to open schools anytime soon.
And can I just ask, I know you say that vaccination is only one tool in our armoury, but low take-up of vaccination among some ethnic minority communities is an issue. How do we improve that?
So I think first we need to understand why that is. So a lot of this relates to the historical context where these communities have been repeatedly let down by the government, our medical services, and our scientific community. So unless we address that and acknowledge that, it's very unlikely we'll be able to win their trust. And this means essentially engaging with them and addressing their concerns rather than dismissing them. This is not anti-vax sentiment. It's very legitimate vaccine hesitancy from being let down repeatedly, including in the current pandemic.
And quite clearly, the government is trying to move on improving levels of trust.
Well, I mean, they don't really seem to have a clear community engagement approach. It's very top-down, telling people to take the vaccine, telling people why it's important. But public messaging has been really, really poor, you know, including around the dosing of the vaccine. And people have a legitimate concern.
Sure.
And it's quite understandable why people have those concerns. So unless they actually engage directly with leaders, youth organizations, and partner with them, I don't see this going away anytime soon.
Dr. Gurdasani, got to leave it there. Thanks very much for talking to us.